It's not a summer vacation. We call it the August work period. Media calls it the recess, and different people call it vacation. It's just not so. Because of our responsibilities, particularly in the majority of the Congress, we have to move legislation and deal with it, and things kind of pile up back in the district. So when you have a work period, whether it's whatever it is, a short one or like 4th of July or now this August work period, we're very busy, and so we try to make use of that and catch up on appointments, get around to the communities, and get around our educational institutions, whether it's elementary or high school or college, university or community college. We try to make those catch-ups and contacts and do those things that we want to do. So we are there to represent, so we have to stay in touch, and this is a chance to do that. It was challenging because first off, there's a great need. We've known that for some time. That just didn't happen in the last few weeks or few months. We've known that the cost of health care is going up, and the availability. When you find out that over the last year, maybe 2 years, that 1 out of 4 Iowans do not have health care coverage, how much more serious does it have to get? And so I want us to be working on this, and I'm appreciative that this president, predecessors have not, and we can go back 1, 2, 3 administrations. He said we got to take this on, and he's right, because it must be done, and it's not easy. So anytime there's change, all of us, we kind of resist change. That's kind of a human thing, and then you get a change kind of, if you're not careful, that develops into some anxiety, and then if people start pushing some false information, then that becomes fear and anger and all that. Anyway, my point is it's very personal, and I know that. And so I was willing to, and I am willing to talk about it to anybody, everybody. It comes up in every meeting, and we've had our town meetings, and they've been covered and so on. But they've gone reasonably well because I understand how people feel about this very personal thing that's happening in their lives. Yesterday, I had a person come up to me that I haven't seen for years. They're not in my district, but they came up to me and said, we're kind of desperate. We got a pre-existing condition, and the wife has been working at a plant that just closed down, and COBRA runs out in a short time, and so we're going to be stuck without any insurance at all. Well, that's not right. We don't have to do that. We don't have to do that. So this plan that's controversial, this HR 3200, is really patterned after what's done for all government employees. We're talking about big numbers, maybe 8 million people, big numbers. And the government employees, which in this case I fit in that category, but we pay in, our employer pays in, but it's really a private setup. You get right down to it. But so we use that for a pattern and see if we can make it available to everybody. Serious matter. To me, it must have been quite a serious matter when they decided to do Social Security back in the Roosevelt days. Then you go on a number of years and decide to do Medicare with Johnson days. That's big stuff. Well, healthcare reform's big stuff. But always, without fail, as far as I can recall, we had healthcare came up before we adjourned or whatever it was, meeting with business people or meeting with students or whatever. It always came up, and so we expected that, and that's okay. Just in the vicinity right around where we have our district office, there's a lot of young people starting new business. People in the 20 to 30 age categories. And so we decided to bring a group of those together and let them share with us what they're being confronted with, and to talk about health care. It was interesting. They all were willing to talk about it. They came, and they all are either giving or they want to give health care, and the sacrifices they'll make themselves so their employees can do this. And so we got through the meeting, and some of these I'd not met before. Maybe a couple I had, but most of them I had not. And we got to the end, we asked the question. Now, you've heard all this discussion and pro and con about the public option, etc. Would you mind showing your hands how many of you think we ought to have a public option? And I have no idea what they're going to do. And every hand went up without exception. But they said this, and they all seem to echo in. We don't want just any public option. We want something that gets down and takes care of this needs and allows us to have the opportunity to give our employees insurance that's affordable and accessible and available. So I think that was a good thing. I really appreciated that, and we're going to keep track of them because they've probably got some other good ideas we need to know about. I don't claim to know every answer to everything, but I do try to go find out. And that's why we always have staff there, and we'll take if the person wants an answer, get their name and their contact, and we'll go do our best to get that answer and get back to them. I think it's important to them, and it's important to me. So we try to do that, and I think those points come across, and still people are in this high state of personal feelings, but nevertheless, I think they pick up on it. You're sincere about it, and so therefore there's some satisfaction that goes with that.
Thank you very much. Thank you.